Hi, I'm Dr. Rasika,
Hi, I'm Dr. Pavan.
and today we are going to talk about the most interesting and commonly asked questions by our patients during pregnancy. So, shall we start?
Absolutely, we can.
So, this is a very fun question that do you have to eat for two?
See, traditionally people do say the oldies in your family will say that because you are carrying a baby you have to eat for two, but it is not necessary. You can eat sufficient amount of diet. That has to be complete diet for yourself, and you have to eat frequent diet in small portions, so you don't have the fullness and the bad tummy with what you can have by eating little stuff, or you're eating too much at one point of time, so you won't have that problem.
So, it's basically that you don't have to eat for two. जितनी भूख है उतना ही खाना है. So the next question is it is a very commonly asked question, and it crosses the minds of many pregnant males as well as females, that is sex during pregnancy normal? Having sex during pregnancy normal? Are there any complications if you have sex during pregnancy?
So this is a very interesting question for all the viewers. See, the sex during pregnancy can be normal, but the only thing is that it has to be, your doctor must tell you that your pregnancy is normal, you didn't have any first trimester or second trimester complications like bleeding or pain.
Yeah.
If everything is fine, then you can have, of course, have sex during pregnancy, but you have to use contraceptions. See, there is a possibility that some patient might say that they have pain after intercourse, but that pain can be just like a Braxton Hicks contraction. If that pain persists, then you have to consult your gynecologist definitely.
Okay.
And one more thing I would like to add, many patients ask what position to use for sex during pregnancy. So it can be whatever comfortable to the patient or the pregnant woman.
Basically, the pressure should not come on your tummy,
Yes.
on your back. If it does not, it's fine. Next question is, if you miscarry if you take stairs or lift heavy objects during pregnancy?
So this is again the common question that is asked by many patients. But see, what happens when you are not supposed to do any heavy activities during pregnancy, that is going to tire you. If you get exhausted by any activity, then you should stop doing it. It can be your routine work, it can be your exercise, it can be lifting something. If it is causing you trouble and it is exhausting you, you shouldn't do it.
Correct.
But actually it does not cause any abortions.
Yeah, it does not cause any abortions. See, if you have any medical complications, like if the placenta is low-lying, or if
Absolutely.
there's any history of preterm labor or history of previous miscarriages, then definitely you should avoid it. And you should always go and ask your doctor about your whether we should do it or not, and they will really guide you considering your previous history.
But then this does not mean that you should be tied up to the bed.
Yeah.
Okay.
You have to be very active during your pregnancy. You should do all the normal things that you have been doing before pregnancy, and you can carry forward them when you're pregnant.
Yes.
So next is that, does big belly have difficult delivery? This is pretty unusual, but people do ask.
See, nowadays with the rising trend of obesity, the patient do think that if they have big bellies, that means it is a difficult labor or they have to undergo cesarean section. Neither of them is true. If you have a big bellies, there is a possibility, considering your medical history, your obstetric history and the complication at the time of labor, your gynecologist is the best person to suggest you whether you can undergo normal delivery or cesarean section. Since big belly is a problem during any surgical procedure, so cesarean section in you is going to be difficult.
Little bit difficult. It does cause little bit problem if you have a big belly or you are obese basically. So do you have to avoid seafood during pregnancy?
There is no need to avoid, because there are women who are staying in Goa and coastal region who get pregnant and they eat only seafoods and they don't have any issues. So eating seafood is not a problem during pregnancy.
Basically, if you don't have any allergies or you're not allergic to seafood, you can eat it. But you always have to keep in mind that whatever you're eating, or whatever meat or seafood or whatever you're putting into your stomach, has to be well cooked.
Yes.
So this is a very commonly asked questions, and there are so many myths around this one particular food which is so healthy to eat during pregnancy and otherwise also, which is is papaya, when consumed during pregnancy, can cause abortions?
Whether eating papaya is going to cause you abortions, but actually it does not. Any fruit that you eat can be consumed during pregnancy provided it is hygienic. Papaya does not cause any problems in the pregnancy. It is a rich source of vitamins. It has vitamin A and multiple vitamins that is necessary for the pregnancy. So eating papaya is not going to cause you any problem.
Yes, it does not, and it's a very good fruit with lots of fibers and rough veg. So it really adds and it really helps you fight with the constipation,
Yes,
which
absolutely.
females suffer during pregnancy very
Yes.
commonly.
Any fruit that has more fibers is good for you because it is going to avoid constipation.
Yes, absolutely. So, do you need to avoid coffee in pregnancy? It's
It's
yeah,
actually
because
now
nowadays
in the Nagpur is
yeah.
a place for the coffee capital probably, because now the trend in the coffee in Nagpur is increased like anything.
Yes.
But see, having a coffee or any drinks in excess is going to be a problem. Coffee does cause acidity, gastritis, and upset stomach. So you can have 1 or 2 cup of the coffee in a day, but having too much of coffee is going to cause you problems.
So you can just have maybe a cup of coffee if you really crave for it. Like most of us are really addicted to coffee and you really want to start your day with coffee. So 1 cup won't make a difference. What about alcohol in pregnancy?
See, alcohol is strictly no in pregnancy, definitely.
Yeah.
There are so many patients, they argue to it that having little bit of alcohol is going to be okay, but then studies have shown that having alcohol during pregnancy, you are not at risk, but the baby is at risk. Baby can have alcohol syndrome, and later on the cognitive features of the baby might get affected.
So what diet during pregnancy, another is a very big thing that patients really ask. ये खा सकते हैं क्या, क्या avoid करना चाहिए, and there are so many myths around food basically.
See, we both are gynecologists and we deal so many patients
Yes.
in the OPD, and many patients do have a lot of craving. Like some patient who had come to me, she was having a craving of tapri ki chai. You understand? So if you have a craving, you can definitely eat whatever you want, but the only thing is that it has to be well cooked. If you are eating it from outside, you are not supposed to have any raw food outside, because you can have gastroenteritis that can cause you problem.
So see, everything has to be eaten in a proportion. All kind of food, you can just eat all kind of food, you can fulfill all your cravings, whatever you crave during pregnancy, but it has to be eaten in certain proportion, because otherwise also if you're not pregnant, if you indulge yourself into something in a lot of proportion and a lot of quantity, it is going to give you a stomach upset. So same goes with pregnancy. If you eat something beyond or out of proportion, it is obviously going to trouble you. The next question is, which is asked by the people who are trying to get pregnant basically, that is preconceptional visit important?
Yes, I would definitely recommend all the patients who are recently married, not just preconceptional, but even if you are recently married, you should consult your doctor, consult your gynecologist, because nowadays we have seen the surge in the infertility, and infertility can range from small things that can be corrected to a very irreversible factors. Those can be there. So for healthy sexual life, so it is always better to consult with a doctor and get yourself checked.
Yes, basically you have to rule out any preconceptional morbidities.
Yes.
That is very important. So these are the most commonly asked questions according to us. And if at all you find any need, or if you want to ask any more questions to us, you can obviously DM us on Instagram.
So for more such amazing content, you can follow us on social media platforms.
So see you in the next video.